founder of the Hunyuan Fertility Center in Greenwich. She's going to discuss creating balance and healing through acupuncture and TCM, the importance of Shaoyin energy in any fertility treatment in the missing first half of the story. He originated the Hunyuan Fertility Method in 2002, using his knowledge of both Eastern and Western medicine. The accomplished acupuncture practitioner invented a treatment that is both forward-looking and grounded in the ancient past. He's a scholar of Chinese medicine for the past 20 years and has also studied Western health sciences in depth. In 2005, he authored the Hunyuan Method for Fertility. Is that one of those books? Yeah. And in 2010, Curing Infertility, the incredible Hunyuan breakthrough. He's a native of Israel. Seidman began his studies in modern Chinese medicine from 1989 until 1993 in Israel and New Zealand. He recognized the deficiencies in the contemporary approach. He resolved to Chinese medicine's classical approach. In 1994, he moved to Freiburg, Germany, to study classical Chinese language and literature and began taking frequent trips to China to explore the classics. Seidman was awarded a Doctor of Acupuncture and Oriental Medicine degree by 5 Branches University in San Jose, California, following a 2-year fellowship and a 300-hour IVF clinic internship. So welcome, we're really excited to have you here.
So thank you, Nina, for inviting me for this series. Also thank you, everyone, for coming. I want to do my talk today in 2 segments. First, a general introduction, then Carrie came today to tell her story, which I'm very thankful. So she'll tell her story, and then I will talk about things that are more concrete to fertility and has more information in that respect. Now, I want to start by talking the general issues that we have here that really occupies me a lot. And I will start by saying that yesterday I talked to a patient from Australia. I do long distance over the internet. The patient, the couple were really, really nice. And the woman said, you know, I'm so desperate, I'll do anything. And I hear that a lot. And I told her, and I'm just repeating it here, I said, doing anything is the wrong thing. You just need to do the right thing. And this is really, and I explained it to her and her husband, you know, that when you have a really, really difficult battle, the right thing to do is, first you need knowledge, but in order to do that, you need to have focus, concealing itself, and then you need to find the right thing to do, and you need to go at it at full force, rather than trying to start throwing your hands in the air and do desperate actions. And oftentimes when I see patients who do IVF and surgeries, and I'll do anything, and I do appreciate it. It requires a lot of courage from a woman to do it, and women are notorious to be courageous. But if you do it in the wrong direction, it doesn't matter how hard you go, most of the time you just get damaged. And this is really what occupies me the most and how I introduce the issues. Why am I doing this Hunyuan, what it is for. And for us, Hunyuan is, between me and my colleagues, we call it Hunyuan medicine. In reality, this is Chinese medicine. It's just that Chinese medicine today is a little different, and it's not what we're doing. So we kind of, when we talk amongst ourselves, we say, in our Hunyuan medicine, we do this, that. And today I'll explain a little bit. But in reality, it is Chinese medicine. It's nothing else. But it's not what we practice today, and that's why we kind of differentiate it. This is a more classical, ancient kind of approach to what medicine should be like. And what I am very occupied with, and this bothers me the most, and many people around the world in Chinese medicine circles, they know me and they say, yeah, this is a critical guy. Whatever I say is always criticizing everybody. And to a certain degree it's true. And the reason I do that is not, or at least I hope so, it's not out of arrogance, like I'm better than everybody, but rather it's because I'm a patient. And my children, and I have 3 of them, they are patients. And my wife is a patient. And my friends, and my brothers, and my neighbors, they are patients, people that I personally attach to. And then, of course, my patients are patients. And when I am a patient, and I have some problem, which sometimes I get, whatever it may be, I'm very concerned about myself. And I want things that I do, whatever remedy I choose to take, to be very truthful. Because my life is at stake here. And when it is my little kids, their life is at stake. That's why I'm so very paranoid and anxious about it, and I want whatever I choose to do, it doesn't matter if it's Western medicine or Chinese medicine or whatever, I want it to be true because these are my kids, or my wife, or myself. And likewise, it's the same for my patients. So the reason that I'm like really paranoid about it, and for the last 20 years really devote my life to research and contemplate these issues deeper and deeper, is because the life are at stake here. And the things that came to me from seeing so many patients over all these years, is that there is a terrible status quo here, in Chinese medicine and Western medicine. Terrible status quo meaning there's all kind of things happening and nobody is saying anything about it, and there's nothing to say because it's well accepted, and I guess that's the way it should be. And this is, for me, when it comes to my kids, it's unacceptable. So let me just raise here 2, 3 rhetorical questions. It's like, how many of you know what a fibroid is? Everybody. How many of you know what a blocked fallopian tube is? Everybody. At least for women who try to get pregnant, they go online, the chat rooms, and everybody knows that. But if I ask you the same way, why, let's say you have a fibroid, why do you have a fibroid? Why is it there? The answer is always, I don't know. Why is the tube blocked? We know what a blocked tube is, but why is it blocked? Why it's not blocked for her, it's blocked for you? I don't know. Why do you have cysts? I don't know. Why is the FSH elevated? I don't know. Why can't you get pregnant? I don't know. This is, for me, is very unsettling, you know. So of course, but we have something in our society that says, it doesn't matter what you do, at the end you go to a doctor, they fix you. Or to an acupuncturist, or to a herbalist, it doesn't matter. You go to a doctor, you get it fixed. And this is, for me, I believe, at least personally myself, is insufficient. You know, when I bring my child to a pediatrician, which I do for well visits, and they said, oh, he has this and that, and you need to give him this medicine. And I said, well, why does he have ear infection? I don't know. This is, for me, immediately a turn-off. It's like, something is wrong here, and this is really the research that we're doing in Hunyuan medicine. We call this the missing half of the story. And just in the introduction part, we believe that when it comes to medicine of any sort, Western medicine, Chinese medicine, or anything you call medicine, there should be 2 questions the doctor and the patient should ask themselves. The first question is, what I'm going to do, the treatment in this case, or lifestyle modification, or whatever it is it going to increase my life, or is it going to decrease it? This is always the #1 question before anything else. And for women trying to get pregnant, the second question will be, is it going to help me get pregnant, or is it going to harm my chances to get pregnant? And this is always the question #2, not the #1. So, and today there is a status quo, and I'm afraid, after seeing at least 1,000 IVF patients and spending many, many hours in IVF clinics and seeing it, there is a status quo here. The status quo is, and this is unfortunately also in Chinese medicine, and again, I'm being critical, not out of anything else but believing that me, myself, is the patient, right? Not because, you know, my thing is really good and the other is really garbage. It's not about that. We have in Hunyuan kind of medicine a real concern for what we call life. So when we believe, and there's I just finished with some of my graduate students and colleagues from around the world. We recorded a Hunyuan patients course. You can find it on this website, hunyuan.org. 10 hours of classes, talking about many different subjects in a very, very deep way. So today we have very tiny little bit of time. I can only introduce something. But for this purpose, we believe that the first thing that should be done is to give knowledge to patients, because knowledge is real power. And since I released the course last week, it took me 2 months to record it with 4 of my colleagues from Sweden, UK, and Australia, and the West Coast. And we recorded it for 2 months. And I released it last week, and within this 1 week that my patients get access to this course automatically, I had 3 patients that came back to me. One of them said, I went to an IVF clinic. Some of them also want to do IVFs in different ways, natural IVFs or what have you. And they said, I talked to the doctor and I said, I want this and that. They watched the course, they started understanding all kind of ideas, and they said, I want this and that. The doctor said, we're not doing that. They just walked out. another patient went to another very famous acupuncturist on the West Coast. And I'm talking in this course also about acupuncture, what should be right, what is wrong, what harms your chances, what makes it better. And she went to this acupuncturist, again, very, very famous. And I'm just sidetracking for a minute. Most patients don't have any tools to assess anything when it comes to treatment. Most of the time we say, who's more famous? More successful, he must, I say something, he says something, whoever is more famous has the word. And that's why many practitioners also don't listen to me, because they are much more famous than me. They have people standing outside the doors and they make already so much money, and I'm just this little guy from Connecticut. And then I came with this great idea. I said, I'll teach the patients. And that's a different story. So what we're teaching in this course, for example, is really knowledge. And as I explained at the beginning, something that you can hold on to and understand how truthful it is, and then you run full force in this direction. Of course, our goal is to get as healthy as possible, and that leads to pregnancy. This is the ultimate goal. But this also patient that went to that acupuncturist told him, I need this and that done because I understand what, and the practitioner said, oh no, we have to stick needles here because this circulates the blood to the uterus, and they just walked. This I call the patient power. Meaning it's not because of my word, it's not because I'm famous and they listen to me. It's in this course we really explain what needs to be done, why and how. And today, after Carrie's talk, I will explain a little bit of it. And this I think is very important. But these two questions about life and about if this helps me or doesn't help me is very important. When I get to the second part of the talk, which is a little bit more technical, you see the kind of things we talk about and how is that related to getting pregnant and all and things like that. One thing I want to mention before I give the mic to Carrie is that really we believe in our kind of medicine, Hunyuan medicine, that when patients get pregnant, it is something for me actually to learn from, because it takes, as a practitioner, because for a person to make such a transformation, to be able to get pregnant, is something that is not easy. And for us practitioners, we always think, we know better. Like, I'll tell you what to do, I'll give you herbs, I'll give you acupuncture. But in reality, it's not like this. It's all falsified. A person needs to do a real transformation in order to get pregnant. In the course, I talk about it very clearly on different levels, from spiritual to emotional to physical to the surrounding to lifestyle and everything. Herbs and acupuncture is just one assisting tool. This is not the goal. And on the other hand, we explain other things in that course, like, when doctors tell you you're infertile, your FSH is high, you're too old, your eggs are too old, this has a very physical impact on the woman's ability to get pregnant or not. And this is a common practice, what I call the status quo. It's accepted, we call it in modern medicine, the real truth, which in my perspective means ignorance. The real truth means, you have cancer, sorry. They don't understand that as soon as they say that, the psychological impact make a physical issue with what we call the center and one thread of life that today I'm not sure we have time to go into, but in the course I explain clearly. And this make a physical impact, and then you can get pregnant. So in other words, the real truth made you infertile. This is a nonsensical. Like to tell someone to the contrary. And one patient told me, when the doctor once told me, oh, it will be okay, you'll be fine, kind of sweet talk her, she got even more upset. For a good reason. We're not talking about sweet talking the patient. Like when you encourage a patient and give her real hope, first of all, you need to have some merit behind it. And this is the kind of things we research into. What does it mean? What knowledge are we looking for? And I'll talk a little bit about it after Carrie. So from patients like Carrie, me myself study a lot, and I'm so happy that she came today to share her story. And then, so if you could, please. And then I'll come back and talk to you more.
So I'm Carrie. Dr. Seidman asked me to come and just share my experience, and hopefully it's helpful and inspiring to you guys. I don't know. Just to give you some background, I want to give you a little of my medical history. In May of 2004, I was diagnosed with non-Hodgkin's lymphoma, which, for those that don't know, is a blood cancer. And as part of the treatment, the treatment was to do 3 months of chemotherapy and 1 month of daily radiation. And leading up to that, they explained that with the chemotherapy, my ovaries would most likely be compromised and I could possibly be sterile. So that was upsetting, but at the time I was 32. I had just met my now husband, so that really wasn't top of mind. But they said that one option was to harvest eggs and freeze embryos. That obviously wasn't an option for me then. The second option was to take Lupron, which is a drug that shuts down your ovaries and puts you into menopause. So that's the option that I chose. And the theory there is that if your body's in menopause, the drugs won't get to your ovaries as easily, and therefore you may not be as compromised. So I did a month of Lupron and chemotherapy. I then developed an extensive blood clot in my left arm and had to come off of Lupron. So I had 2 months more of chemotherapy in which my ovaries were unprotected. So I got through treatment, got a clean bill of health, all was well and good, got married, decided to have kids. And we tried for our first child, and as luck would have it, in first try, we got pregnant, and I had my daughter in May of 2007. Then we decided to try for a second child, and things were not quite as easy. And my oncologist had always told me that if you try for 3 months, given my history, you really should be seeing an expert. And so we tried for 6 months. I called my oncologist. She said, go see somebody, it's time. So I went to an IVF clinic in New York, and they began me on Clomid, and I did that for a month, and I produced 1 egg. They then upped my drugs, and they gave me IVF drugs, and I went through the whole gamut for 7 months. They increased my drugs every month. Every IVF cycle was canceled but one. When I was able to produce 4 eggs that month and 4 viable embryos, they didn't take. All the other months, I basically produced 1 or 2 eggs, despite the amount of drugs they could give me. Nothing helped. And so at the end of 8 months, my doctor sat me down. He basically said, there's no hope, just be happy whether you have 1 child, etc., etc. You're 36, everything that Dr. Seidman just said, you're 36, your FSH is 13.5, sorry, sorry, sorry. So at that point, I just moved up to Westport, Connecticut, and I was sitting in my, I remember it so well, sitting in my living room and just crying, because it's just devastating to hear that that's your family, or you're not going to have kids, or whatever the case is. And a friend of mine had said, have you ever tried acupuncture? And so I was sitting there, empty rooms with my computer and Googling acupuncture, and I happened upon Dr. Seidman's name, and he was right around the corner for me, and I said, okay, I'll make a consultation appointment and get started. Now, I was a complete skeptic of Eastern medicine, didn't understand it. So at the same time I made that appointment, I also made an appointment with a new IVF clinic in New York to go and see someone better and someone that could fix my problem. So I saw Dr. Seidman, I think 2 days later or something. It was very easy. The other appointment was 3 weeks. And right away began acupuncture and herbs. And the interesting part, and the reason I mentioned the IVF clinic, is I then went 3 weeks later to see this new doctor, and part of that workup was an ultrasound of my ovaries. And during that, he saw 7 developing follicles. Now, I'd never had 7 developing follicles in 8 months, you know, when they've been monitoring me. So something was going on. And there are lots of other things that changed as I started taking herbs and acupuncture, and I can answer questions about that, but things just changed, and you felt yourself changing. And it turns out one of those 7 developing follicles turned into an egg that turned into my son. So I had a son in July of 2010. And being greedy, my husband and I decided we wanted to try for a third. And we didn't have high expectations. We said, you know, let's just try it. Either way, I was going to go see Dr. Seidman because you feel better anyway when I'm going to see him. And so in April of this past year, I went to see him and started on herbs and acupuncture. And I'm now 8 weeks pregnant, so it's worked again. Hopefully. See the doctor on Wednesday. And so it's just amazing what happens with his method. And he already touched on it a little bit before, but the most poignant and comforting thing that he said to me on the first appointment is, I walked in there and he said, this isn't because you're 36, this isn't because you're old, this isn't because you had cancer. He said, it's because your body's not healthy. And he said, as soon as your body's healthy, women can, and in many cases will, get pregnant. He said, that's what a woman is meant to do. And that's just stuck with me, and it's the truth in my case at least, and the statistics, which I don't know you'll talk about, but his statistics are amazing in terms of what they do for IVF patients and for patients in general. So I can answer questions or finish the talk and answer questions, whatever you like. Yeah.
Well, for me, you can learn very little. From patients, you learn a lot.
Which herbs did you find were most helpful?
Oh, I don't even know what I taste. It's all written in Chinese. I looked them up a while ago.
There's one Chinese one that I used to manage a Chinese clinic in California, and I was so intrigued with all the benefits of the herbs. So yes, they're written in Chinese, but I started to look them up. So one that kept coming up over and over that the doctor would always prescribe to the women, I'm like, I have to find out what that is. And it was Angelica sinensis. Do you know about that? What is that?
Well, it's not good or bad. If you use it wrong, it is bad. If you use it right, it is good. What is needed is the knowledge, when and how and why.
But I mean, is it like a Dong Quai? Is it a
This is
cooling?
Dong Quai.
It is Dong Quai. Okay.
This is Dong Quai.
And it's cooling to the system, like if you have a lot of heat?
Well, this requires a whole talk.
Oh,
But I will talk a little bit about it as soon as Carrie is finished. But
I think it's amazing with the herbs, because when I first did the first session, or the first treatment with Dr. Seidman, I was looking up all of them, because I was like, what's going on? What is this medicine he's giving me, etc. And it was interesting, because every single month, one little thing would tweak. It just, one tiny thing is added, one thing's taken away, and he's always saying, it's because it's the time of your cycle, or it's the, I don't know, he's the expert on it, but but whatever it is, it's just it's incredible, and every time if you say that I've been cold this month, or I've had headaches this month, one thing gets adjusted, and all of a sudden you feel better. It's incredible.
Now, were you doing the charting along with that?
No, that's the other thing that's very relaxing in this whole thing, is where you went to the IVF and you'd get in there and they'd say, okay, it's day 12, you ovulated today, go have sex every single day from now on, have it twice a day, whatever you do, and you're just like, this is no fun. He's like, every other day, day 10 through 18, have a good time. It's just so much more relaxed. It's like, oh, I can be a human, and my husband's a human, and this is fun. It just changes.
How are you taking the herbs? Is it in pill form or?
It's tea. And sometimes in the morning, sometimes before breakfast, sometimes after breakfast. I don't know. There's a whole meaning behind it. Sometimes after dinner or before dinner.
How quickly after you started did you start to feel any kind of change?
The first time I noticed it the most, because I was just really paying attention. And I'll tell you, the most amazing thing talking about mucus was mucus. I mean, like all of a sudden, things just changed down there, and all of a sudden you're in the mood, and it was completely different. So I noticed within a week. And then the reason I mentioned the IVF doctors, because I could see it in a Western medicine sense. I could see what was happening. I mean, that had not happened in 8 months. I had not seen more than 4 follicles one time. But
was that the first month you were on it? Was that 1 month?
It was 3 weeks into it. I went and saw this doctor. I mean, I did start noticing things, though, after a week or less. I was noticing things.
What was happening, was there a lot of stress in your life at that time when you were trying to get pregnant? Because we were talking a lot about stress and all that, I mean,
you're going to the IVF doctor. I got a 2-year-old in tow, trying to take her on the subway, keep her quiet while he's doing things, and I mean, that's a lot of fun, and in the meantime, trying to sell a house, trying to move to. I mean, there's a ton going on, and so stress was huge. So I'm sure that played a huge part as well, But it's also just the comforting words that were said, and the idea it's not my fault, and it's everyone else is like, it's cancer, sorry. As you said, it's cancer, sorry.
Why didn't you want to harvest your eggs?
I just met my husband. I didn't have anyone to make an embryo with. I wasn't ready to ask him after 4 months of dating. So. And they basically said that if you take the eggs and freeze the eggs, it's not going to really work. So it's not worth it. Because it was an aggressive cancer, so I had to get started, and that would take a while. And from what happened later on, I don't know if it even would have worked.
So that must have been fun, being on Lupron, going into menopause.
I never want to go into menopause. It's the worst thing that ever happened to me.
Having chemo at the same time, too.
Go to menopause. That's another story, another time. Don't want to go through that again. Unfortunately, I think it's in the cards.
Well, that's also a sudden.
I was in menopause within 5 days. When I was cut off. They shot me with so much stuff.
So now you said it's a tea. because I've had these teas before. It was like drinking mud.
The tea doesn't always taste good. Sometimes I complain, there's everything else in there, come on. Sometimes it's really sweet, sometimes it just tastes like you're in the middle of the forest or something.
Yeah. Felt like I was drinking dirt.
Yeah, it has a very ancient taste to it. I don't know. It changes each week.
Get through it.
Great. No.
Thank you.
Thank you, Karen. Well, the thing is, you know, some of the questions that you raise here, which are good questions, like about Kanbui, what is it? In reality, there's huge topics here that requires education, which I made available in this patient's course. So every question that you ask, I can just finish it with one sentence, and then you said, oh yeah, you said that. And the course is actually to give patients real knowledge, and on a variety of topics, including herbs. So you said I took some herbs, tasted like mud. So in reality, you know, within Chinese medicine, there's a wide discrepancy of things happening, and patients don't even know. You go, it says the sign on the door, acupuncture, that's it. And I'm very critical of this, because I require a lot of myself. Earnest in learning and contemplating the problem, which is not common practice. And that's why I allow myself to be critical. You know, so, because for me it is personal. It's not about trade, and I have, and in the course I'm also mentioning it, but I had an instance maybe 2 or 3 years ago that a very famous practitioner that he's a friend of mine, I said, listen, you think twice about what you say, especially in public, because, you know, then people are not going to invite you anymore to speaking engagements, and, you know, you lose business. And I've been thinking about it for a long time. It's like, what is it about? Is it about my business? Or is it about me and my kids and my wife and other patients, other people? And that's why I'm saying it, you know, not to offend anybody, but really this requires serious contemplation and breaking the status quo in Western medicine and Chinese medicine. That's what I do with this course. It's very, very seriously intimidating a lot of people, because there's no rules here. Like, we teach knowledge, and I ask the patient to contemplate it with me, to find it in your heart. Does it make sense to you or not? For example, just off the top of my head, if you take drugs and you feel miserable, hot flushes and you feel bloated and this and that and all the other stuff, is that good? And then everybody said, I'll do anything. It's not about doing anything. It's like, first of all, you need to recognize that when the human body gets stronger, healthier, and feel well, this is good. It's not that this is just a luxury, but if we really just want to get pregnant, it doesn't matter if I feel miserable. You know, this kind of, it's a status quo, like, let's just not talk about it. And I've seen more than 1,000 IVF patients, and I can say that maybe 10 of them didn't feel miserable when they did fertility drugs. 99.999 feel miserable. And there's a problem. There's another problem for me, and I'm very, you know, it's unsettling to me, aside from the issue about the impact on life, if there is impact, etc., is when you look at statistics, the success rate is quite miserable. Let's say women over 40 or 42, okay, so not 20-year-olds. It's 98% failure rate, which statistically means it's a margin of error of success. It fails all the time, and there's a margin of error in success. This is for me unsettling, but nobody talks about it. Today I spoke to a patient today, and I explained to her some issues, some problem, and I really tell her, you know, think about it. Is it good? She said, but why am I sitting in the clinic and it's full of people? And I went to another clinic in New York and it's full, and all the patients, they said, which doctor did you go? And they take numbers and they go, and it's also full. Because, and I have an interesting story to share with you from another, and again, I love Western medicine. It's just that I'm against the status quo. You know, Western medicine is good, just don't say anything. Whatever bad goes on, it's good. I'm against this. Because at my kids, I'm not happy if it happens to them. And that's why I'm speaking up. That's the reason. And I have a really interesting story from a doctor that I know, reproductive endocrinologist, an old-timer. And he said, you know, he told me a story when I was in California and things, doing my doctoral. He said it was very interesting. At the time, IVF was just starting, 1980. And he said, I went to the hospital where I moved into and I wanted to set up an IVF clinic. The year was 1980. And I spoke to the panel of doctors, of the administration, etc. And I told them, let's do this IVF. And they said, what is it? He said, you take an egg from a woman, you take a sperm, you put it in a dish, you explain to the doctor what it is. They told him, what are you, crazy? We're going to spend so many millions of dollars, no one is going to do it. That's what he told me. That was 1980. And today's story is completely opposite. It's full, swarming with people, and that makes everybody comfortable. It's called like, yeah, look, it couldn't be that everybody's wrong, right? Millions and millions of people, but I have a problem. I have an issue with that. And it's not because it is wrong. And I've seen, you know, in my hours in IVF clinic, I've seen many patients that can't get pregnant. Whatever with the uterus issues, no tubes, and without IVF, they will never have babies. So I'm completely for it. It's just that today it's not so much used, it's more abused than used. That's the problem. And nobody talks about it. And nobody will say go to anything else or Chinese medicine. Like, what is this quack? And with this I have an issue too, with the quack of Chinese medicine. You know? I have an issue with that. You know, yesterday, I'll tell you, that's why I took my phone. A friend of mine, and again it's all personal stories as it relates to me. A friend of mine in England, in the UK, just emailed me, said, I have to see you, you have to see my wife now on Skype, can you do it? I'm not sure if to take her to the emergency room or not. And she has history of heavy bleeding with the period, so heavy that she's going to pass out, like severe bleeding. So that was a situation. She has a bleeding for a week, and I go on Skype with her, and I look at her, and she said, I feel like I'm going to die, and she can't open her eyes, she's completely white, and you see a person in a very, very dangerous situation. And my friend said, well, and he has herbal pharmacy and everything. And he said, you know, what do you think? What should I do? And I said, just these 2 herbs in a huge dose. And no one will do it in common kind of practice. It's like, go to the hospital right away. We can't do these things. And I asked him today, because of course she recovered quite good. I said, could you email me what happened yesterday? Because I want to tell it, not more, not less, not make it fancy, and not just really what happened. And if you don't mind, I just want to read what he said, what happened to his wife yesterday. And when I saw her, it was very, very scary kind of thing. Like he said, I need to take her to the emergency room right now, you know, because she said, I feel like I'm dying. And he said, you know, after many years heavy bleeding, occasionally under control, she went from ghostly white to normal color within 3/4 of an hour on this formula of 2 herbs. Although obviously she needs time to rest, her words are, felt consolidated, could breathe again. Previously she felt she couldn't catch breath, and the feeling of panic had subsided from actual fear of death, also stopped sweating and was able to close eyes and actually sleep peacefully. This happens like in 45 minutes. And this happens to me many times. Like this I call the moment of truth. And unfortunately, much of Chinese medicine today can't deliver it. And that's why Western medicine say, what is this quack? Like when you need real medicine, you know where to go. It's in the hospital. And I have a problem with that too. So you see, I say Western medicine, but with Chinese medicine, likewise, I have an issue.
I think it's so unfortunate what I'm hearing, because so many people go to acupuncture and maybe are not getting the correct treatment.
Well, this is why I did this course. Big part of it, we talk about what, first of all, what's the principle, what we should look for, what the treatment should or shouldn't be like, and I explain everything. It's not like take my word. I explain it, and I hope that other practitioners, hopefully maybe they'll watch this talk too, they will want to watch this course, and at least they'll prepare an answer. Like we do something else, but it needs to be a real answer, because these patients are much, much smarter. So you can't just say, yeah, I said, or... And the problem with Chinese medicine today, and Western medicine try to get away from that, is the way we study it today in school is with what I call he said, she said. It's this kind of a knowledge. Why do you do this herbs, dang gui, like you asked? He said, she said. It doesn't matter if it's 500 years ago. In that book, he said dang gui is good for the period. Why is it good? He said. This is for me very unsettling. The way we study Hunyuan, which is Chinese medicine, we just give it a different name as if it's different. There's nothing taken for granted, and I'm very, very suspicious about Chinese medicine and Western medicine and everything. It's not that I know better, but I'm very suspicious because my life is on the line. And my children. It's very important. and my patients because of that too. And that's why I'm critical, and status quo doesn't count. And I don't care if I get less business and nobody will invite me. Like, who cares?
I invited you.
Thank you very much. But I tell you, many times I got to this point. Not often do you get to such criticals, but I got to it already many times. That this is like real situation, and including with my family, with my little kids. When he was 1 year old, my number 2, he had an attack of croup. 2 o'clock in the morning. Can't breathe. Very, very scary. Needs to go to the hospital right now. And I said, listen, I've been studying Chinese medicine for 20 years. I better know what to do. So I went downstairs. I have in my basement a herbal pharmacy, and I whipped up some herbs and I gave it to him, and it doesn't work. Because, unfortunately, and I'm sharing it with you, just for one moment of panic, I was thinking like the way I studied Chinese medicine in school. The symptoms look like this, do this herbs, this might help him breathe. Didn't work. And I remember I went down to the basement, I put my face in my hands like this, and I said, I've been meditating on it so long. Now this is the moment, right now. It needs to work right now, not in an hour. And I whipped up a dose of herbs, which is very potent, that most practitioners will not dare touch 2 grams of it, and I used 50 grams, a batch like this, and this is a 1-year-old baby. And I mixed it with hot water. There's no time, I can't cook it. It's just mixed, stirring it in hot water, and I went upstairs, and it's a baby that can't breathe, it's like a panic. And I take a baby bottle with the medicine in it, make sure it's not too hot, and I shove it down his throat, and he doesn't want to drink, and it looks awful.
I'm sure it tasted pretty bad.
Yeah, no, but a 1-year-old baby, and it's your baby, it's not in the movie, it's real time. And it took about 5 minutes, and all of a sudden, you see, start breathing. And after 5 minutes, he falls asleep, and the next morning he wakes up, nothing happened. Healthy.
Yeah.
Now, this kind of Chinese medicine we don't normally deliver, and that's why Western medicine look down at Chinese medicine. It's like, with Dang Gui. Dang Gui is like, chat room kind of information is not good enough. Dang Gui could be very harmful herb. Could be what we call life elixir. The only question is if you understand the principle. Like, what is it? What should it be? What shouldn't be? Why should I use it? And most people, they don't know. They said, yeah, it's good for periods. And then one time I had a patient came to me and she said, I took Dang Gui for 3 months and my period stopped coming. For like 6 months I didn't have a period, and I went to my OBGYN doctor and I told her, and she said, of course, Dang Gui, everybody knows it's bad for the period. The patient doesn't know, the doctor doesn't know anything, and what kind of a conversation is that? And this is what I call chat room information. It's not valid, it's not good. And we need to find real knowledge, and I'm trying to teach people. I think this is the most valuable, aside from me just giving them treatment. Now today, do we have some more time to talk, or did I eat up all the time? So I just want to give you just an idea, for example, what we talk about right now is just a general kind of fancy talk. I didn't give you anything concrete. We have some time, a few minutes?
10 minutes.
10 minutes, okay. So again, in this course that I just put out is 10 hours of classes, and I tried to summarize it into 10 minutes, which is very difficult. But in Chinese medicine, or at least if we apply it right, what we are concerned most and foremost is about life, what it is, where is it coming from, where is it going to, what's the principle by which life is working. And we have, and if I want to summarize many, many years of research, I want to summarize the punchline, is that we believe that life comes to the body, and the body does not make the life. This is the difference between Chinese medicine and Western medicine. Western medicine say your organs, they make it. You own it. There's no relationship between you and nature because you make the life. It's only coincidental. You don't have to be outside. The season doesn't matter. Day and night doesn't matter. You don't want to go to sleep at night. It doesn't matter. Right? But there's a problem with that, as we explained at the beginning, because we don't know anything. Why fibroid? I don't know. Why blocked tube? I don't know. And this is very also not so good. So we're looking into this, and how do we study it for the last 3,000–4,000 years? Chinese medicine, in a right straightforward manner, they see there is an issue here. We live through our life, we get to the end of our life, and then we finish the life, right? We pass away, and then you see a cadaver. So anyone, without being a doctor or not, you look, you see a living person, you see a cadaver, a dead body. There's a difference. The difference is not the body. The body is exactly the same. Like right when we finish our life, same heart, same muscles, everything is the same. Same ovary, same uterus, but the person is not moving anymore. Not talking, not eating, not breathing, doesn't want to write, doesn't want to do anything. And this is what we start to analyze, like what's the difference, what is it? And this actually is very much related to fertility and creating new life. Because when we make a new baby, this is not another body. It's actually another life. And unfortunately, modern medicine knows very little about this. And this is why they say, all what we need is you take a sperm, you take an egg, that's a baby. But it's false. This is what we call the partial observation. Meaning you see with the eyes, and this is what it is. There's nothing else to it. Meaning it's all physical. Just what I see, that's what it is. But we find a great difficulty with this. And I can give you one example, for example, with very advanced equipment. You can see at 5 weeks or 6 weeks, you can already see in the embryo what we call a flattering heartbeat. The reason they call it flattering heartbeat is because there's no heart yet. You see a movement, there's no heart. How is that a heartbeat if there's no heart yet? Meaning there is, and definitely there's no body, there's no head, there's no spine, there's no arms, there's already life. Their life first. The life comes to this thing we call embryo first, and then the body starts to form. And you know, in modern medicine, because we don't have research about life, which doesn't come from the eye, it doesn't matter what big of a microscope you have, it comes from what we call the heart contemplation. We think about life, we call it investigating the phenomena. It doesn't come from the eyes, right? So for example, I'm just giving you one small topic in this course that I'm teaching. If you look at the men ejaculating sperm, you clearly see that the sperm is being ejaculated outside the body. When you look at a woman, you can't call it ejaculating an egg, but she releases an egg, the egg doesn't leave the body. So again, if only what we are occupied ourselves with is the physical matter, it doesn't matter if you take the egg and you ejaculate it. Meaning in IVF, that's what happens. We ejaculate the eggs outside the body because the doctor can't work in the uterus. The doctor needs the platform to work on. But then I'm asking myself, who am I trying to help here? The doctor or the patient? I'm not trying to help the doctor work, I'm trying to help the patient get pregnant. But unfortunately, we don't have this first knowledge or the instrument to make the fertilization inside. So I don't have to take it out. And anyhow, it doesn't matter, because you take the egg, you put it back, same egg, what does it matter? But what I'm asking you now is not to see with your eyes the egg, because we can't see any difference, is rather like contemplate it with your heart. According to nature, male sperm is being ejaculated. Female egg is not being ejaculated. Is that like a coincidence? Like it doesn't matter? Or it's a matter of good luck, bad luck, which we often hear in IVF setting. You know, you get pregnant, good luck, didn't get pregnant, bad luck, a kind of a science. It's not. There is a reason, but the reason is not with the physical body. You take the egg out, you put the egg, it's the same egg. What does it matter? That it doesn't work 98% of the time, then it's bad luck. But I believe that it's not the case. This is what we call a partial observation. We're missing half of the story, that's why it doesn't work. So this is just one item, for example, specifically related to fertility, like what happened when we ejaculate the ovum outside the body, which we do in every IVF cycle. Does something happen or it doesn't matter? So again, this is something you can't find with the eyes. It does not belong to the physical matter. It's something that you contemplate. Of course, we need some more tools to assess that. Right now, we not necessarily have all the tools. But when we talk, I drew this circle. We have something that we call recharging capabilities. Now, when we live our life, there are certain actions that we have to take. We have to drink, we have to eat, we have to go to sleep, all the things that we recharge us. Let's say for a minute, you say, especially in modern society, I'm the boss. I'm going to do whatever I want. So I'm not going to eat, and I'm not going to breathe, and I'm not going to sleep, and I'm not going to do anything. I'll do whatever I want. All of a sudden, the 100 years that you have to live became 2 minutes. Like there's no more life to talk about, right? You stop breathing, that's it. There's not much time left. But if we do this recharging things, like eating, we get nutrients, we breathe, we get oxygen, we drink, get water, we sleep, we recharge something else, which we can't elaborate on it right now, but all kind of things that we do to recharge, and all of a sudden we have 100 years to live. But what happened with the years as we age? I'm still eating, I'm still sleeping, but we start aging, right? My hair turns white and things like that, and I'm getting older and older. At the end, when I'm passing away from this world, I'm still eating, but it doesn't go into my body. I can put an apple in, but it doesn't being absorbed. And what we have here, we call this the recharging capabilities. This is what you mentioned at the beginning, the Shaoyin energy. The Shaoyin energy is this recharging capability. Not the food that makes me alive, it's my ability to take it. And this diminishes with the life. Now, making a long story short, when you try to get pregnant, and you have an egg and a sperm, and you put them together, aside from the body, what else is going on there? Because we are talking about life, a living entity, not a body. It needs this recharging capability. From day one, as an embryo, it needs to be able to recharge from the mother, and then when it leaves the uterus and become a baby from other sources, from the earth, from heaven and earth. But it needs to be able to recharge. It needs this Shaoyin energy. So if the mother and father don't feel healthy, or do things that are harmful and making the Shaoyin energy weaker, when you have intercourse or IVF, you take the sperm and the egg and you put them together and there's not this energy to recharge, you put it, and this is called 95% failure. It doesn't work and we don't know why. The body was there and I looked at it and we did PGD testing, the genetics is perfect and it doesn't work. And you paid all your saving, it doesn't matter. It doesn't work and we don't know why. And this is something, the answer is not with the eye. And, Western medicine, I'm absolutely sure we'll get there. If it's 50 years from now or 100 years from now, but we just don't have this 100 years to wait. For them to know that I can take the eggs out, that I can give stimulating drugs that make the Shaoyin go outside, because what it does is, the way to get more eggs from a woman is you give this kind of treatment. The Shaoyin energy is here. Everything goes into storage, we call it recharging at the bottom of the circle, and again this is a very, very difficult, it requires much time to explore. But when you do things to take the energy out, to get more eggs, it makes the Shaoyin weaker, and 3 days later you try to transfer the embryo and there's nothing left to support it, and that's why it doesn't happen. So if we want to get more fertile, regardless of IVF, without IVF, we have to do this as more going to recharging to build it up. And guess what happens when you do this? With herbs, with acupuncture, with Qigong exercises, with diet, with sleep, with lifestyle, if you do the right things, you feel better. You do the wrong things, you feel worse and worse. So I ask you to contemplate about this. When you do things, let's say even fertility drugs, that make you feel worse and worse, is it making the Shaoyin energy stronger or weaker? It's not, it's like a rhetoric question. And that's where people are missing. Like the patient that I mentioned at the very beginning of the class, from Australia, she said, I'll do anything. It's not about anything. It's not about being courageous or desperate or anything. You need to do the right thing, not anything. Because if you do this anything, it's getting worse and worse for your lifespan and for the ability to get pregnant. Now, of course, what it is and how to do it and all the many aspects from spiritual, emotional, physical, etc. This requires knowledge. That's why I put this course out. Like, there's a lot of information there, a lot of issues to contemplate. But the bottom line, I've kind of delivered it in a few minutes. So, again, I believe it's not about Chinese herbs, it's not about Hunyuan or any other names or any kind of thing, but it's about real knowledge. And for me, myself as a patient, I need it, because I need to do the right thing. in whatever situation, if it's my son, if it's my friend in the UK, or whoever else, or my patient. I need to do the right thing. And today I had a patient, and which she knows that, and I explained to her, and she said, I already decided to do IVF. This literally hurt. And you know, some friend of mine told me, you should take it so personally. You just do your job, go home. You know, you try your best. You explain to them, and they do whatever they want. But you know, I feel that the responsibility of a doctor is a little more than that. It's not about, you know, you paid me and I told you and you didn't get it, go home, good for you, whatever happened to you. It's not. It's a certain responsibility that comes from the heart. And that's why I'm, you know, a little paranoid about this. To put this out and try to promote it and try this, it's not about the business aspect of it. It's rather there's something so much more important. Again, there's a lot of information today. My time was way, way too short. I could just deliver a punchline. But that's, you know, getting knowledge, I think, is power. I think maybe the time is up. I mean, I can go on and on for hours, but...
I have a question though.
Sure.
Yeah,
It's
let's
a good
open
time
up
for
for questions, it'd be great,
Do
yeah.
you only treat issues with infertility and fertility?
Well, generally I do, but sometimes, like the case I mentioned yesterday, was an infertility. So people who know me, or brother and sisters of patients, they said, well, you know, they have other kind of issues. You know, I had a few months ago a very old person, 88 or 82, of someone that was, I mean, a patient of mine is a doctor, and that's his friend in the hospital, that's his father. If I could help him, he was almost about to die in the West, and they're all doctors in the hospital. And they said, we did all the testing, it looks like the father is gone. And they said, like, you're the only things left. I mean, we don't really believe it, but that's the only thing left. And we did it, and I just emailed the son, we became kind of friends. And the son is like a senior doctor, the head of a department in that hospital. And he said, yeah, thank God, he's still here. And he said that he thinks it never helped him, the herbs, but he never talked about wanting to die anymore. He's doing pretty good. You know, so that's, I don't really need the recognition, but if he's still alive, it's good. So, but how about other questions?
What do you think are some good ways to find a good acupuncturist?
Watch this course. Absolutely. I mean, we did a very, very thorough work. First of all, explaining the principle and ask you to meditate on them, see if you agree with them or not. I mean, you know, I didn't have much time to explain, but explain like separation and unification, what does it mean, etc., etc. And if it does make sense to you, then we do all the herbs. Like the herbs that I use in my clinic are about 30 herbs. A regular herbalist has maybe 200. I only use 30. And normally it's just 15. And every time I give the same formula and I just change one herb. I make this, but now there's a situation in the circle here and I just add this one herb. The patient looks at it, looks almost the same. It's a completely different. You know, like if you add dangui here, it's like a tremendously different. But today the way we study is very, very different. It's like, yeah, this symptoms, we do this herb. We have a lot, I call it fancy it up. There's a lot of stuff, a lot of herbs, a lot of knowledge. What's frightening about this course is that you do this 10 hours course and you might know more than many, many practitioners. This is frightening and very intimidating, but I don't care. It's not even for me, and I don't want the patients to come to me. You know, if they want good, there are other practitioners in the course that did it with me together around the world. It's not about this. It's like really careful patients, you know it. You know it, and then you say, do whatever you want. But so it's not really I say it. Normally it's like this, he said, she said. I say these acupuncture points are good. I say these herbs are good. And then you go to another practitioner and he said, no, I say this. And at the end the patient said, he said, she said. This is not our kind of medicine, what we call Hunyuan medicine. If you learn this kind of knowledge, there's not, you know, this one patient from Australia, she told me, when, you know, because one of the practitioners is from Australia on the course. She said, well, should I go to him to do acupuncture? I said, sure. She said, is he going to know? Because she watched the course already. I said, well, I mean, he participated in the course and he studied with me already for a few years. He knows it very well. But if he doesn't do it, you'll know it. You'll know why. And then you disagree. Like all of a sudden the patient has power. Like, you know, and most of the time the power is wrong. It comes from chat room. No, in the chat room, that doctor said this, and this is wrong kind of knowledge. But real knowledge is not because you take my word. I tried my best to explain myself. You meditate on it, and if it makes sense to you and it sounds like the truth, then this is the truth. If it doesn't make sense and another doctor will explain something else that will make more sense, then be it. But this is at the minimum that I require. Like I explain it very thoroughly. Someone else believes otherwise. Just give a good explanation that match in the level. Not just because I say, I think that this is really good. This is no explanation.
So can you just, for those of us who like don't have a lot of experience with Eastern medicine, because we've always used like the Western medicine approach, can you just sort of talk a little bit about the difference, the philosophical difference, like how you approach like PCOS from an Eastern perspective, or how you approach endometriosis, or some of the other things that we're hearing, high FSH, all that kind of stuff. Like
this is very simple. We ignore them. We ignore them completely. You know, if you do it right. The modern way of doing Chinese medicine is not. They get very much into the Western medicine things that, oh yeah, PCOS, maybe yin-yang, PCOS, somehow try to merge it, but this is a big mistake. You know, because we're looking at the first half of the story. The PCOS or the blocked tube or the endometriosis or whatever it is the second half of the story. Like what happened at the end. What happened at the beginning, we don't know. You ask the doctor. It's called etiology unknown. Don't know where it's coming from. So what are we treating if I don't know where it's coming from? You know, we made what we call in the ancient classics, they say you made the thin one thick and the thick one thin. Meaning the important one you made secondary and the inferior one you made the most important, which is a problem. And this oftentimes is a mistake we do in Chinese medicine. Some of us, you know, it catches us because we are not very confident. We never saw miraculous thing with Chinese medicine. We heard about it 2,000 years ago, but we never saw it. So it catches us, Western medicine, who is very powerful, at least in their department. Much more powerful from the average kind of Chinese medicine, and that's why we have to kind of follow them because they are real medicine. And we're kind of, you know, alternative, helping, but when we need real medicine, we know what real medicine is. That's a big problem. The premise is a big problem. It renders Chinese medicine ineffective, in a sense. You know. So in that respect, when you ask, what would you do to PCOS? What would you do to a blocked tube? Like, who cares about this diagnosis? This is like the inferior part. What happens is, what happened to this energy that makes the tubes work, or the ovaries work? This is the cause of the problem. And again, there's a lot of issues. So the course that I do here for patients is not on that level. There is another course that I'm teaching for practitioners. It's like a year long. And that's a different story. And it's very, very difficult. And I had actually 2 patients do that, but it's just this, you know, they can't. So practitioners have really difficult time putting their hands around it. So in the patient's course, it's different. It's teaching just knowledge, but not how to be practitioners.
Right.
So this kind of circle, which we call the unification and separation circles, there are different issues here, different parts. So if there are different symptoms, let's say you have endometriosis and breakthrough bleeding and severe pains, for us it has nothing to do with endometriosis. This is a problem, either here, or what we call the Yang Ming, Jueyin axis, and all kind of issues. That when we do the herbs or acupuncture or lifestyle modification or emotional advice or spiritual kind of practices and all kind of things, is to make this work again. And guess what happened to the endometriosis? What do you think? It gets better. I have a patient now in the course, in the last class, in the 8th class, I asked her, please, can you write a letter? And again, I don't want to take off of Carrie's story today, but there's a lot of these. And she was, according to her, according to the doctors, already 2-3 years ago in menopause. Premature ovarian failure, the ovaries shrunk. Shrunk, you see in the ultrasound. Right? It's not something theoretical, it's shrunk. And they said, we're sorry. Why is it? I don't know. Right? We know this already. And then, and she was feeling really bad, and the whole story is in the course. She wrote a very, very lengthy kind of description. Bottom line is, she came to me about 4 or 5 months ago, and she had severe hot flashes. The doctor said you have to take HRT at least for the next 5, 6, 10 years, and nothing else is going to work. So she describes it. After 4 weeks, all the hot flashes went away. My energy came back. After 2, 3 months, we had one session, and she lives in Boston. And she said, I just want to thank you. It looks like, saved my life. And again, not that I need the recognition, and I'm talking about it in the course. She did such a transformation in what she understands on a very, very high level that I was actually dumbstruck. This doesn't happen. Practitioners can't reach this level. What she did. And guess what happened last month?
She got a period.
The period started coming. Not that she started coming. I told her do the temperature, which normally I don't recommend. And then she saw a dip, and then she saw it goes up, and 14 days later it went down, and she got the period, like ovulation, and everything happened. The luteal phase was just on time. Despite what the doctor said, you need many years of HRT, and they already shrunk, and you're in menopause for 2 years, and we're sorry. And the sorry doesn't help.
Right.
And I don't know doesn't help.
That's just the same diagnostic that they gave me. So I'm doing HRT, and they said I cannot stop the estradiol and the prometium, and that I have to keep going with that until I get 45, I think, because I'm going to have osteoporosis, and that I have POF.
But the main problem with that is that if you go to 100 doctors, they're all going to say the same.
Yeah,
and
they said they don't
right.
know where it comes from.
And this is what I call the status quo. Because everybody doesn't know, that means that's the truth. Like I don't know becomes the truth. I mean, what kind of truth is that? It could be many things that I don't know. I'm not saying that I know anything, but I'm very, very unsettled by things that I don't know. It's not like I don't know, thank you. That's what we have. And if someone else will release a study, then we'll know 50 years from now. It's not. It's like, for me, the pursuit of medicine is like this. It's very unsettling. There's things on the line here. Life of people. And that includes myself and my family. That's why the pursuit of medicine for us, practicing Hunyuan kind of medicine, is not an easy process. It's like we're always feverish. It's like, what else? What else? How can we solve it? What's the reason? And many times it doesn't come from a microscope. This is a huge problem in modern society, that they teach us that medicine will solve it for us. And at the years past, 100 years ago, you would tell it to an old lady, my grandmother. She said, like, who are you joking? You have a cold, you need a doctor, you give chicken soup, this kind of an attitude. Like it was very natural. Like we know, I need a doctor to tell me that my kid has a cold. Or ear infection, we know it. You put hot compress, and this, like people knew it. But today it becomes more and more the grind work of modern society. Is like you don't need it because the doctor is going to take care of you. And guess what? We have such expensive equipment and huge microscope. You're not going to be able to see what we see. So don't even bother. But the secret here is that real knowledge comes from the heart, not from the eye. So it doesn't matter, and what we call observing the phenomena, like I just said, the sperm and the egg. You just need to meditate on it long enough to understand the meaning. Like, why doesn't a woman ejaculate the egg? And in the course I give some thorough explanation. But these things didn't come from the eye, like I didn't look. Chinese medicine as a whole, at least in its ancient kind of version, didn't come from the eye. It's all from what we call contemplating the phenomena, from the seasons to practical things, physical things. I'm not sure if I answered it.
No, you did, thank you. I don't actually anything else.
I have a question for you. If you don't do the basal body temperature charts, then how do you see what's going on and determine what herbs a person needs? If they have liver chi stagnation or too much heat, or how do you determine that if it's not done?
Well, chi stagnation, too much heat, and this is all modern fluff. Does not belong to Hunyuan medicine. This came much, much later. Again, it requires a deep discussion into this, but this kind of concept does not belong here. We're talking about the essence of life. What does it mean? So this kind of issue is a different topic. But sometimes I recommend patients to do the BBT charts if their cycles is very, very irregular. 50 days, 20 days, you don't know when, you can't have your husband have intercourse 100 days in a row. That's why.
You might like that.
That's why. But other than that, if the cycle is regular, 30 days, 28 days, even 35 days, like on time, every time. I mean, they could chart one time to make sure that the luteal phase is right, so 14 days before, that's when the ovulation happened. You just need to do it one time, you see that that's how it happens. And then you have a fertile window, which is about 8 days, 10 days long. During this day, this is when you can get pregnant. But again, you know, there are other issues here, which are like emotional and spiritual issues. So what happens when a woman tells her husband, now it's time? You know, most men can still function, but is it just about functioning or not? Like, is there something else? And again, if it's just what meets the eye, there's nothing else. I just need to know when the ovulation is. You need an ovulation kit, then you'll get pregnant. So what with all these millions of women that do ovulation kits all the time and don't get pregnant?
They don't work for me.
They don't work.
They don't work.
Why not? Ovulate
I
it.
don't know.
And more than this, let's say, you know, you found the ovulation, but the sperm, even though we ejaculated 50 million sperms, none of them could find the egg, right? Which is very unlikely. But let's say you didn't. So what's the answer for all these countless IVF cycles where the egg did find the sperm, and yet you're not pregnant? Like, we ran out of excuses. You can't, and you said, okay, genetic abnormality, so we do PGD testing for another 5,000.
Blame your eggs. Your eggs are old. That's what they tell you.
You know, this is very interesting. I have a lot of interesting stories because I've seen so much IVF, so many IVF patients. But many patients that did IVF that I saw, the embryos were great. Some of them even did genetic testing, you know, PGD, which is very expensive. And then they put them in, and then there's no pregnancy. And then they tell them your egg quality is not good. This is like almost, I don't know what to call it. Like, you looked at it, it looked good, you tested it, it tested good, you put it in, it didn't work, it probably wasn't good. I mean, is this science? So, sometimes when you run out of excuses, it's difficult. But you know, with our kind of medicine, it's not that I want to make any wrong impression. Like, yeah, no problem, you come this way, everybody gets pregnant tomorrow. It's not like this. This process of increasing unification and Shaoyin energy, it's a, what's the word I'm looking for? It's a monumental task. Because you know what happens when the Shaoyin energy gets stronger? Like, what really happens if it gets really stronger? Instead of living to be 70, you're going to live to be 80. And accomplishing this is a monumental task. So it sounds easy, yeah, no problem, let's do this. This is very difficult, it doesn't happen so easy. And this is why patients who get our treatment or do the other recommendations we do to increase this unification, they all feel better, they all feel great. And like, to compare it to feeling bad on drugs, feeling well, what do you think? Does that increase your lifespan or decrease? Let's say you had migraines and now you don't have migraines anymore. The period wasn't coming and now the period is coming. You used to have back pains all the time, now the pain in the back doesn't hurt. You feel cold all the time and now you don't feel cold anymore. You just have to look for the answer in the heart, because from the eye, we can do this study. We can do this double-blind study. It's funny, the Western medicine say double-blind study, but they only use the eyes. I just thought about it. But, like blind study, but we only use what we see with the eyes. So, but this is what I think. This is how we contemplate the phenomenon. So when patients start to feel healthier, in many ways, we can't think that it's wrong, even if the Shaoyin energy didn't get strong enough, and even if it didn't end up in a pregnancy, because we answered the first question. Is this going to make the patient live longer or less? And the answer is always positive. So even I go home and many patients didn't get pregnant at the end of the day, I sleep well. You know, I feel that I did my job well. You know, because this is the #1 question. The second question, which is also very important, and I fully understand if you can't have a child, it's devastating and really devastating, etc. But this does not equal compromising your life. And again, I'm not saying anything bad about IVF or anything else, and I like Western medicine very much, I just think that it is inadequate. And the status quo is like, we're pretty comfortable. Why? Because the offices are full of people. So we are very comfortable. When the office is going to be empty, we're going to be maybe not so comfortable. You know, so it really starts from the patients. And right now the knowledge is not there. So we follow the herd mentality, and the history proves itself over and over again that doing this is a mistake.
Are there any studies that are done right now on the effects of IVF drugs on our bodies? Has anybody actually, I mean, you were talking about just the pill itself and how that increases breast cancer. I'm just curious, I would imagine.
There was a huge study in Australia, and they found that there was some link between patients that in the first 2 years after IVF they have a 200–300% increase in breast cancer.
I heard it was a big.
But they really buried it at the end of the study. They said the numbers were too small, so just forget about it. But again, it's not my job to criticize them, but I'm just thinking myself as a patient. If I were a patient, I'm a male, so of course, normally we don't get the IVF drugs. But let's say my wife, she could get the IVF drugs if she needed it. I have a personal issue here. Is it right, is it wrong? And one time I heard on the radio a talk with a very famous IVF guy from New York City, and the interviewer asked him, he said, well, some people say that there's a relationship with cancer. What do you think? Right, the IVF doctor. And he said, listen, we did all the study, we concluded that there is no relationship, and dismissed it. This is what I call the doctor is too comfortable. And he's very, very famous. I know many celebrities went to him to do IVF. Like his clinic is full, out the door, down the street, people waiting online.
There's a lot of studies done on the effects of IVF children, that they're having so many issues with fertility, ADD, depression.
But the question is why? Nobody knows.
Yeah.
But I think, this is at least what my heart tells me, and I don't have many millions of dollars to do any study. It all comes from contemplation, and including my colleagues who study with me together. When I look at people that try to get pregnant and they feel sicker and sicker, especially at the time of conception, this is what happens during an IVF treatment. I just can't contemplate it being good. Not for them, not for the baby, not for many future generations to come. Like my common sense says that we need to understand what being healthy is. There's a whole issue there. That it really means your ability to synchronize with nature. This is the meaning of being healthy. So a woman, for example, ovulates once a month in conforming to lunar cycle. Around full moon, before full moon, after full moon, that's when you ovulate. And you can be 10 days before or 15 days later. So every woman ovulates differently. But it's all in relationship to that cycle. It shouldn't be every 60 days, every 90 days, every 5 days. It's every lunar cycle that a woman ovulates. There's an issue there. What happens with the moon? The man conforms to the sun. That's why he can ejaculate every day. The full moon comes once a month. The sun comes every day. So you can ejaculate. The sun, and I'm just throwing out many ideas from the course.
I'm just thinking one of my favorite movies is Moonstruck. And he says when the moon brings the man to the woman.
No, but in reality, this is something that is real, because the energy, the life, our life, and there's a whole issue there, what time means, and all kind of stories that we don't have time to go into here now. But there is a relationship between nature to us. That's why when the sun comes down, I want to go to sleep. When the sun comes up, I want to wake up. Even though people say there's no relationship. Today, I want to stay up until the morning. Right? This idea of being connected is not anymore. And that's a problem. More so with modern fertility treatments. Many times I have patients come to me. They want to do IVF and such. And they said, well, the doctor put me on a pill now for 3 weeks before we can start the stimulation, because the embryology department is closed for the holiday.
Yeah.
And I'm asking myself, like, who are we serving?
Must have been NYU.
No, it actually comes from all the clinic. And I understand them. But really, what is medicine for? To help the embryology department, the doctor, or to help the patient? So there's a status quo here, which is like nobody talks about, because the clinics are full with people. And as long as this happens, like who cares what this guy from Connecticut says? Who cares?
Well, even the statistics, I mean, if the statistics over 40 are like, 2% chance. I mean, how is that any different than your own statistics when you're 40? I mean, when you're 40, your fertility goes down, so you have less chance to conceive, but you're not getting that much more of a chance.
No, but rather, you know what happened, and we really, there's a lot of issues we didn't have time to go into, but this issue we call Shaoyin energy that helps the embryo have this. When we age, this decreases. So it becomes less and less. That's why I start to have white hair, and I have wrinkles, and I start to age because of this. So when a woman is 20, the Shaoyin energy is very strong. So you go in with fertility drugs, you extract whatever 20% out to get 30 eggs, whatever, and it looks like they all fertilize because there's a lot of energy to go around. Even if you ejaculated the eggs, there's still to go. And of course you can't leave the eggs more than 5-6 days in the dish. Right? They say 5 days is better than 3 because then you get blastocysts, and blastocysts is a better chance. So just leave it for 2 weeks in the dish. But no egg will survive it past 6-7 days unless they freeze it. Which this is also beyond me, I don't know what happens there. But, and that's the question is like, why don't you just do the whole pregnancy in the dish? Why not? So to the contrary, when doctors will get smarter and know about energy, they'll know that even if you do the IVF, you take it out, you fertilize it, put it right back. What are you keeping it for? To know which one is better, to get better statistics or what have you? Like who are we serving? This is another problem. So there are many, many issues related to that. But with the younger patients, you take some energy out, and the egg still can fertilize, and pregnancy can still take, because there's a lot to go. But when a woman is 40, and men too, not just a woman, this energy starts to decrease. So when you stimulate the woman, and you take the energy out, the chances of fertilization to happen is very, very small, what we call 2%, right? Marginal error of 2%. And doctors don't understand it. When a 44-year-old woman goes to a clinic, they say, well, listen, you're 44, we need to get really aggressive. They do the opposite. This is, I call the status quo. They don't understand the first half of the story, and I'm sorry, I'm a little guy from Connecticut, and there are trillions of dollars, whatever industry. I don't care. If they don't want, nobody of them should send me any patients, that's fine. They do the opposite on the patients. And you know what happened very often with older women? They call them your poor responder. I give you 700 IUs of stimulation and I didn't get one egg from you. You're too old, your eggs are too old, your ovaries are too old. The doctor is wrong. He did the wrong thing. Not just that he did the wrong thing with the treatment, he still blames the patient for it. So I'm asking you, what kind of medicine is it? And I hope the doctors will forgive me. I can't hold silent, But I can tell you that much. Patients should, first of all, find this information, which is not readily available in chat rooms. And when this is about this one patient I mentioned at the beginning. She went into IVF clinic, she understood this. She said, I need X and Y. I don't want this drugs. That's going to ruin my chances. I said, no, you're too old. We need to blast it. Get aggressive. And she said, I couldn't explain to him. I just had to walk out. This is called patient power. Patient knows, unfortunately, more than the doctor. And the doctors will know that. Many years, I don't know how many years, because I know that in modern science, they talk a lot about energy, physics and this. None of it is in medicine yet. They don't know how to put it together. And what do you think IVF doctors, according to the history, how Western medicine develops in very big steps, 100 years from now, they're going to look back on this IVF today. What do you think they're going to say?
Idiots.
They didn't know about the energy in the cells or whatever, which we don't know today yet. But I know that there is life to these things. Embryo is not a body. It has a life, and we need to understand about life to make it successful. IVF, not IVF, we need to understand about it.
What if you've been trying for a long time, you've tried a number of different things, the IVF, the Eastern, the Western, like all of that, nutrition, all the different aspects, and you've gone through that whole process, and then it's still not happening. Any thoughts on that? That's kind of a big
Well,
question, but.
I think the first thing is to get as much knowledge as possible, because then you can fine tune. You know what's the truth, and then you need to go on it as hard as you can. And maybe you're not going to succeed, but going in many directions, which very often I see with patients. I did this, I did that, I did IVF, I did massage, I did the acupuncture. Just try to shoot in all directions. This is what I call throwing the hands in all directions in desperation. You lose the battle for sure. That's the problem. Many patients say, and I have some patients like this right now, and I'm not saying it in any disrespect. This is the common thing. I'll do this, I'll do that, and often it's in opposite direction. So you help here, you harm there. You help here, you harm there. In Chinese medicine, in ancient Chinese medicine, we have a term for that. We say you go out from home to the shop, but you never get to the shop to buy stuff. You come back home, but you never get to the door to enter the house, and then you go back to the shop, but you don't go there. You don't get there. You come back, you don't enter the house, it's back and forth, not to the destination, not to the origin. This is this kind of situation. First, we need knowledge. Like we meditate on it, we study it. At the end, if we think that fertility drugs and injection and surgery is the way, then go all the way. And if you find out in your heart, because you know who pays the price at the end? The patient that made the decision to do it. And that's okay with me. As a teacher or practitioner or whatever, like you study the subject, you said this is what's going to happen, this is what I believe, and I go full throttle. And if you want the reward, you want it. If you have to pay the price, you pay. The doctor never pays the price, or me, the practitioner. We try our best to help, and again, Western doctors try their best to help, and they are very, very nice people. I'm never saying that they are mean people, really nice. I'm just afraid that missing the first half of the story, for me personally, is not good enough. It's telling, I don't know, it's not good enough. And it doesn't matter if the room is full with people waiting online, and I said, okay, I'll stand online too, because it looks like everybody's doing it. In 1980, the doctors told this other doctor, what are you, crazy? Nobody's going to do this. What woman is going to do this? And look today, everybody's, if you don't do it, you're a fool. It's so it's like, only if you have the money, the insurance doesn't pay, and if, it's a status, I did it, it's, we had it, we did the IVF, we did the PGD, we did this, we did the screening. It becomes whatever term you want to call it.
Is there ever a situation where you would say, oh, I can't, like with my situation now, my FSH is probably 150 or something, who knows what it is. So, I couldn't, even if I wanted to go in and work with a Western doctor, they wouldn't work with me. They didn't want to work with me 4 years ago, and then I got pregnant right after I did Eastern approach.
That was your luck.
Right, that's my luck, exactly.
That's why you got pregnant, because had they worked with you, possibly you would never have a child.
Exactly. Well, I was grateful that they wouldn't even give it a chance, because that wasn't the path I really wanted to go down anyway. But they were saying you have to be aggressive. You have maybe a window of 6 months. This was before they knew what my FSH was. Then when they knew my FSH, they said, sorry, we can't help you, and you're going to have to do donor eggs or adopt.
Well, you know what happened when you take a lot of energy out of here? What happened to the FSH?
It goes up.
And I've seen many IVF patients, maybe half of IVF patients after doing a few cycles, all of a sudden they find high FSH.
Right.
And before it was normal, and then the excuse is, no, it fluctuates. When we tested it 5 months ago, it was just happened to be normal, but it fluctuates. Before it probably was high. It's not our fault, it's not the drug's fault, it's not the surgery, it's nobody's fault except your own.
Right.
And in a sense they are right. Meaning the patient didn't know, didn't have knowledge, did the wrong thing. It is her fault, it's not the doctor's fault. Right. In a very ironic kind of a way. And that's why I think knowledge to the patient is the most important. And this is unfortunate for the doctors. But it is the most important to have knowledge, and having someone tell me, I don't know why, it's not good.
But do you have I don't want to say a cutoff, but Western doctors won't work with someone if they're over, I don't know, whatever the age is, do you know?
Well, if your FSH is over 12.
No, your FSH, but I'm talking about age.
Well, first
It
of all,
depends.
Like she was saying, some people won't work because of her age.
It depends on the clinic, because they basically will tell you what your odds are, and if you want to spend the money, that's okay.
But
with
my
them.
curiosity
Right.
is, because your fertility naturally declines as you get older. That's just given. Is there a point where you would say, like, I'm going to be 45 in January? I've hit or missed on my period, you know, several times this year. So is there a point where you say, like, you know, there's not anything that can help? There's not going to be a way to, you know, increase your shin energy or...
Shower.
Check it.
No, but I'll tell you that much. If you are trying to get pregnant, and as a practitioner, that's what I'm trying to help you do, possibly there should be a cutoff. But this is always the number 2 question. So if you ask me, is there a cutoff for you to help me get healthier and have longer life? Like when you get to 50, I don't want to help you anymore to get longer life.
Right.
At that time, you should just die.
Right.
It's not like this.
Yeah.
So, but if it's a different question, like you just want to get pregnant, all the herbs that I'm going to give you is if you have chance or don't have chance. This is like the merit of the treatment. Then there should be a cutoff. You know, 48, 49, 50, whatever it may be. Okay, we can't take a 70-year-old woman and try to help her get pregnant. But you can take any person at any age to try to help them get stronger Shao Yin.
Which may result eventually in a pregnancy.
Right. You know. So this patient that I talked about before that got her period after 2 years being in menopause, her FSH was 99 when she measured it. The ultrasound looked at the ovaries really shrunk physically. You know, it's not, can't dispute it. And 2 years later, I mean 5 months on the herbs or so, not just that she didn't have hot flashes and then she can sleep, the energy came back and she feels much better. It's not many different things, it's only one thing. Shao Yin got stronger, it looks like everything got better. And now the periods start coming back again because she's only 38, she's not 60. She's still at the time that she could recover if it is really a problem. If it is a natural decline of Shao Yin getting to be 60 and for a good reason, haven't stopped the period, because then that's a different issue. I mean, I see people already want to go to sleep, we can't go into it. No, but there's a different issue we call standalone pivot, when you have ovulation and there's something breaks from the ovary, which we call an egg. It's not a piece of material, but rather it's a piece of this Shao Yin energy breaks because it needs to start a new life. But every time it breaks from the woman, it takes a piece. That's why it can happen only once a month in full moon when the energy is the stronger. So the damage on the woman is the minimum. And it happens only with male sperm with the sun, it's a different story. Every day ejaculate, it's still okay, but excessively also will bring a male decline. But there's an issue here. But the woman that is 38, at her time is still viable. Even if she was in menopause for 2 years, she could still allow the split if the Shao Yin gets stronger. When you get to be 50 or 55, naturally nature moves you into menopause because we don't want this split anymore. We don't want you to die when you're 60. Like, we want to preserve life as long as possible. That's why there's menopause. That's why there's no more split. You know, so this kind of things we are thinking about. And so if there's premature menopause or things like that, sometimes it's not menopause at all. But if we don't know the first half of the story, of course we can't treat it. And to the contrary, you tell the patients bad news, bad news, bad news. And what happens, you know, this is another topic we talk about, we call the center and one thread of life. It goes in the wrong direction. Instead of getting stronger, it gets weaker, just from the devastating news that comes constantly. And all of a sudden you get more and more miserable. Like you were just a little bit in menopause, now you're a lot in menopause. Just because of the news.
Yeah.
And the doctor thinks that this is the hard truth. We need to say the truth. This has merit. They don't know that it just damaged the patient more, and this has no merit to harm the patient. So, in any case, this is the answer to this question.
Thank you. One last question?
It's a question about fibroids. Have you had a lot of success treating women with fibroids? And just like if you had a large one, like do you have any patient stories where they've been shrunk down significantly or eliminated completely?
There's a lot of interesting stories. We don't have a lot of time. But I have a story with a patient a couple of years ago that has a small fibroid inside the uterus. And kind of hanging. They looked in the ultrasound, they said this is a definitely obstacle for getting pregnant. Because outside the uterus maybe it's not so bad, but inside the uterus it's a big problem. So they scheduled her for a surgery, I think 6 weeks later, to remove the fibroid. And then she went into the surgery, into anesthesia, right? In the surgery room. They didn't do ultrasound before. They went in, there's no fibroid. They said, probably we didn't see right. I mean, she took herbs this time. We probably didn't see the ultrasound, sometime made a mistake. So how come you put someone under anesthesia and sometime mistake? Of course it wasn't a mistake, and it was only small fibroid, not a huge one, like orange, you know. So these things can happen, you know, and they did happen to me in different situations, you know. I have one patient just last or 2 weeks ago from Florida. She had well, she didn't have a history of fibroids, but she has bad endometriosis. But this is another story about fibroids. And then she did, and she felt really full like this, and we said, you know, maybe fibroids, go test it, go check it. So she went to the OBGYN, they did scan inside, and they said you have 3 very small fibroid pea size. And it's not directly related to your question, but I think it's an interesting story. That's why I'm sharing about fibroid. So she said, okay, where are the fibroids? The doctor said, it's all over. So she said, what do you mean? You said I have 3 pea-sized fibroids. She said, if you have one, that means you have many, and they are all over. And the patient said, wait, I just want to understand. You said we have 3 small fibroids and it's not a problem. I just wanted to know. The doctor said, well, you're asking too many questions. You know, and at the end, the next day, she was very offensive, and the doctor called to apologize. Maybe she had her period, or I don't know what. But that's related to this. You have fibroids, they're all over, they're not all over. You know, and this is a true story. You know, I'm not making this one up. And, you know, so when I talk to the patient, you know, we can laugh about it, but at the time she didn't laugh about it. You know. But fibroids, again, this is the second half of the story. I have many patients that had fibroid, huge one, and got pregnant, delivered babies, no problem. You know, like grapefruit sized fibroids, and nobody removed them, and they weren't inside the uterus, outside. But so if they did it, not necessarily is a problem. And removing the fibroids, again, that we don't know why they're coming. Oftentimes they grow back, and we also don't know why. This is also, for me, very unsettling, specifically. So the fastest way to remove the fibroid is to chop them out. But I'm not sure that the chopping pieces of the body is the answer. This is the immediate answer, but first of all, we need to find out the reason behind it. So we say in our kind of medicine that as long as your energy life gets stronger, things are getting better in many very different departments.
But even if the fibroid is growing and growing and growing, then what would then help you?
Yeah, well, I mean, I never had that, you know, but I had fibroids that didn't shrunk. But the patients got much healthier and got pregnant and delivered a baby. But if it grows, or if it's cancerous tumor and it's life-threatening, of course this is a different situation. So we're not like blind and it doesn't matter what. So and normally when patients go for the first time and they have fibroids, I always say do 6 months later another scan and see if they've grown. You know, you can't take one point in time, because they might have actually been larger. And now they're still big, but they're actually smaller. So you always have to have 2 reference points and then see, did they grow, did they stay, did they shrunk? According to that, you know if you're going the right way or the wrong way. So this is the minimum. You have fibroids, at least a year later you do another scan and see if you had, of course if you did any sort of treatment in between. If you didn't do anything and you kept everything the same, didn't change lifestyle or anything, there's not necessarily a reason for the fibroid to go away. It happened for a reason, even if we don't know what the reason is. So knowledge, again, is paramount, not necessarily treatment. But knowledge, and then you change your lifestyle or many other things, and you can start seeing differences.
Thank you so much.
Yes,
Thank you.